Good day everyone, I'll be discussing the pneumonia. What is pneumonia, by the way? Pneumonia is an infection that causes inflammations in the lungs and results in fluid buildup, fever, cough, and difficulty of breathing. What are the causes of pneumonia? Pneumonia have a different causes including viruses, bacteria, fungi, and even parasites in some cases. Viruses that can cause pneumonia include influenza or flu, respiratory syncytial virus or RSV, and rhinovirus or also known common colds. The common bacteria that can cause pneumonia include Streptococcus, Mycoplasma, and Haemophilus influenza, and Legionella pneumophila. What are the common fungi that can cause pneumonia include Pneumocystis jivaeresti and Cryptococcus species and Histoplasmosis species. What are the signs and symptoms of pneumonia? The signs and symptoms of pneumonia can vary in severity from person to person. Here are some of the most common examples. Number 1, productive cough, fever and chills, tachypnea, shortness of breath, chest pain, diaphoresis, fatigue, and cyanosis. What are the types of pneumonia? There are 4 types of pneumonia, include community-acquired pneumonia or CAP, and hospital-acquired pneumonia, also known HAP, and ventilatory-associated pneumonia, also known VAP, and aspiration pneumonia. For community-acquired pneumonia, patients sick outside the hospital, and hospital-acquired pneumonia, patients sick at the hospital stay, and ventilator-acquired pneumonia it may acquired when the patient hooked a mechanical ventilator, and aspiration pneumonia it is acquired when a patient aspirates bacteria into the lungs, usually from the food, saliva, or stomach acids. How the pneumonia diagnosed? Pneumonia is most commonly diagnosed by looking of the patient chest x-ray, which will show the signs of consolidations and the other tests, and the patient pulse oximetry would likely reveal hypoxemia and faster of breathing, and tachypnea is common as well. The patient breath sounds via auscultation likely reveals crackles, rails, or rhonchi. If you were performed to a chest percussions, dull sounding note would likely be heard. The patient PFT result would likely reveal decreased lung volumes and capacities. The sputum culture would reveal which type of bacteria is causing the infections. It could be either a gram-positive or gram-negative. A complete blood count will provide the patient white blood cell count in order to help the patient to determine if the infection is viral or bacterial in nature. For instance, increased white blood cells indicate that a bacterial infection is present. Decreased white blood cells indicate that virus is causing the infections. What is the treatment for pneumonia? Pneumonia should be treated on a case-by-case basis, but in general, here are the common treatment methods for treating the pneumonia. Here are the common treatment methods. Number 1, antibiotic medication. Number 2, oxygen therapy. Number 3, bed rest. Number 4, airway clearance. And number 5, hyperinflation therapy. And number 6, fluid management. Risk factors of pneumonia. It is true that patients of all ages can get pneumonia. With that said, some of the more of the risk than others. Here are the risk factors. Number 1, infant lesser than 2 years old, and adult for greater than 65 years old, and those with weak immune system or mahina yung immune system nila. Tips to prevent pneumonia. The CDC recommends certain vaccines for prevent a pneumonia, including the flu vaccines.